Hello, everyone. My name is Alan Ellison, and I'm running for the United States Senate to represent your interests in the United States Congress. I want to thank you for being with us tonight for our Fridays for Florida virtual discussion on mental health. We wanted to have this conversation tonight because this is Mental Health Awareness Month, and we wanted to raise awareness on the mental health issues that are sweeping across our state as well as sweeping across our nation. We have some statistics that we wanted to share with you and possible outcomes and solutions that can help with some of the issues that you might be having. And so some of the prevalent issues of mental health statistics are this. Approximately 1 in 5 adults in the US, or 43 million or 18% of the population, experience mental illness in a given year. Approximately 1 in 25 adults in the US, 10 million or 4.2% of the population, experience a serious mental illness in a given year that substantially interferes with or limits one or more major life activities. Approximately 1 in 5 youth aged 13 to 18, or 21.4%, experience a severe mental disorder at some point during their life. For children aged 8 to 15, estimated it's at 13%. 1.1% of adults in the US live with schizophrenia. 2.6% of adults in the US live with bipolar disorder. 6.9% of adults in the US, or 16 million, had at least one major depressive episode in the past year. 18.1% of adults living in the US experience an anxiety disorder, such as post-traumatic stress disorder or obsessive compulsive disorder, and specific phobias. Among the 20.2 million adults in the US who experience a substance use disorder, 50.5 or 10 million adults had a co-occurring mental illness. Here are some social stats. An estimated 26% of homeless adults staying in shelters live with a serious mental illness, and an estimated 46 live with severe mental illness and or substance use disorder. Approximately 20% of state prisoners and 21% of local jail prisoners have a recent history of a mental health condition. 70% of youth in juvenile justice systems have at least one mental health condition, and at least 20% live with a serious mental illness. Only 41% of adults in the US with a mental health condition received mental health services in the past year. Among adults with a severe, serious mental illness, 62.9 received mental health services in the past year. Just over half, 50.6% of children aged 8 to 15 received mental health services in the previous year. African Americans and Hispanic Americans use mental health services at about half the rate of Caucasian Americans in the past year, and Asian Americans at about 1/3 the rate. Half of all chronic mental health illnesses begin at age 14, 3/4 by age 24. And despite effective treatment, there are long delays, sometimes decades, between the first appearance of symptoms and when people actually get help. Here are the consequences of lack of treatment. Serious mental health illnesses cost America $193.2 billion in lost earnings this past year. Mood disorders, including major depression and bipolar disorders, are the third common most causes of hospitalization in the US, both for youth and adults between the ages of 18 to 44. Individuals living with serious mental illnesses face an increased risk of having chronic medical conditions. Adults in the US living with serious mental illnesses die on average of 25 years earlier than others, largely due to treatable medical conditions. Over 1/3 or 37% of students with a mental health condition age 14 to 21 and older who are severe or served by special education dropout, the highest dropout rate of any disability group. Suicide is the 10th leading cause of death in the US, the third leading cause of death for people aged 10 to 24, and the second leading cause of death for people aged 15 to 24. More than 90% of children who die by suicide have a mental health condition. And each day, veterans die by suicide at the rate of 22 veterans a day. As you can see from these statistics, mental health is a very important issue in Florida and throughout the United States. And we wanted to shed some light on this particular issue because we don't see very many leaders talking about it. We don't see very many leaders putting forth policy to actually help with these issues. And because this is Mental Health Awareness Month, we wanted to give some resources for people. So if you are struggling with mental health or substance use or substance misuse, we wanted to give you a national hotline number to call because we care about you and we want you to get the help that you need. That number is going to be 1-800-662-4357. Again, it's 1-800-662-4357. And that is the number for the mental and substance use disorder. If you are thinking about taking your life and committing suicide, first of all, please don't. There are people that care about you. There are people that are counting on you to get the help that you need so that you can do your part in this society. I'm counting on you. And so I wanted to give you this number to the National Suicide Prevention Hotline. That number is 1-800-273-TALK or 1-800-273-8255. Please call these numbers, get to the resources that you need. Don't take your life. I'm counting on you. People around you love you and they want to see you be better. We can make huge strides towards helping our country with mental health disorders. But one of the things we have to do is we have to work towards policy that can bring the resources to help our countrymen and women so that we can have positive outcomes. We just need leaders who care enough about this issue. And if you care enough about this issue, continue to raise awareness around why this issue is so impactful to not only you, but people who you may know, people who you care about. Because I guarantee you, with as many people as I just talked about that are affected or impacted by mental health disorders, substance use disorders, you could possibly be helping to save a life by raising your voice and speaking to a member of Congress, your congressman or your senator, about this issue. If you feel like your voice isn't heard, then contact our campaign at alanellison.com. And what we will do is we will work with you to get whatever issue you may need solved, help you with resources to get you the treatment that you may need. We have had much success in the past with helping people with treatment programs and providing those resources. This is what I'm here to do, is help. This is what I want to do when I'm in the United States Senate, is to bring the resources and help our countrymen and women get the help that they need, especially when it comes to disorder. People right now are stressed out. They are dealing with anxiety. And some of this is due to the economy, people out of work, COVID-19, the gas prices going up, people watching television and seeing what's going on around the world in countries like the Ukraine and Africa. Watching all of these things is having such adverse impact on our mental health. And right now we need universal healthcare coverage that would include mental health services. Because right now there are a lot of plans that simply do not cover mental health services. And so this is what we need in order to be healthy. I'm all about improving the quality of life for everyone. And we have to do that starting with our minds, because if we have strong, happy minds, then we can pretty much work our way through most issues. But if we're not doing good mentally, it's going to cause problems in almost every other area of life. So thank you so much for joining us for our Fridays for Florida on mental health. At 7:30, we're going to be on Twitter for our Power Hour chat. We're probably going to have more conversations, in-depth conversations on this particular issue. So that'll be 7:30 Eastern Standard Time on Twitter. Look for the hashtag Power Hour chat and find us, join us, and let's be a part of the positive progress in this country. Let's please put aside our political differences. The divide in this country, the social divide, the political divide is doing much to harm our mental health. And we were friends before politics, and we can be friends during politics and after politics. We just have to realize that we do have more in common than not. There are 55,000 different issues literally impacting directly or indirectly millions of Americans. And if we start opening our minds, opening our hearts to one another and communicating about how issues impact us, I'm pretty sure we can find common ground and we can relieve the stress in this country and get on the road to recovery, get on the road to positive mental health. And again, I just want to thank you for joining us and have a wonderful evening. Thank you.